right, we are live.
Okay, we're back after a short break, a little bit after 10:40. And we're going to go through H-171 for some time until, let me get my time straight, just for about a half an hour until about 11:15. And then we have some folks coming in for testimony. Katie, thank you for being here. I think the first thing I'd like to do is to start out and ask the committee if there are specific things that you heard today with specific sections or another day where you think that we should focus our attention. Otherwise, we'll take the high ride through the bill and make stops along the way. Senator Cummings, did you have no? Okay.
No, but I'll chime in.
Good.
I think the financing study is probably the most, I don't think there's any disagreement that child care is essential and it's a good thing and it should be high quality. It's how do we pay for it?
Yeah.
And I think that's the foundation we need.
Do we want to go to that? I think that's section 10 that you're talking about. Do we want to go look at that? And what is it, section 10 or 14? I'm trying to remember.
Section 14.
Yeah, 14. Thanks. So if we go to that, and that was part of some of the comments that we heard this morning from, I think, the business folks. Let's go to 14. Tell me when you get to it. I don't know what page. All right. 10 is on page 12.
On page 18.
Page 18. All right. Thank you. Okay. So Katie, just walk us through what is here, and then we can decide if we think there should be any changes to it.
Sure. So the financing study asks that by January 1st of 2022, JFO is to contract with an economist or an independent consulting entity with expertise in the field of childcare, early education. And this person is to evaluate the economic impacts and potential funding mechanism of adjusting Vermont's existing childcare system for children from birth through 5 years of age. And also keeping in mind the intersection of an impacts with childcare for children who are 6 years of age through 12 years of age, in alignment also with the recommendations of the ongoing Universal After School Task Force that was established in the budget last year. And the section goes on to say that the work of this person is to be governed by the following goals. So the first goal is that the family does not spend more than 10% of its gross annual income on childcare. Second, that childcare providers receive compensation that is commensurate with peers in other fields. And the third goal that's driving this work is the utilization of cost care models versus market rate model in the childcare financial assistance program. In subsection B, this gives the date that by November 15th of 2023, the consultant is to submit preliminary results of his or her work to JFO and to the chairs of the appropriations committees, this committee, human services, the finance committee, and ways and means. Okay. And then in subdivision 2, we have the final report coming in on January 15th, 2024 to the same committees. And this final report is to project the costs of expanding the child care financial benefit to more families in accordance with this section, requiring commensurate pay for providers and utilizing the cost of care in the CCFAP program, and the feasibility of implementing each policy in Vermont, both separately and jointly. So looking at each of these items together to get a financial picture, and also looking at each of them independently. And then this final report is also to identify and determine the feasibility of implementing stable long-term funding sources to finance an affordable, high-quality early childcare system for children from birth through 5 years of age.
So the concerns that we heard, just on the date, beginning with the date, was that 2024 is too late for this report. And I really don't know what the testimony was in the House on this section, or what the reason for their making that change. And I guess it might be related to what joint fiscal can do in terms of reaching out to find a consultant. But I guess the question I would have is, why wouldn't it be 2022, November 15th for a preliminary report, and then 2023 for the final report? And I can't answer that, but it seems to me it might be doable.
There was an earlier draft on the House side, and with earlier dates, and though it was just at the very end that the dates were pushed back, and I can't remember what was the impetus for pushing the dates back, but
Okay.
the original version had contracting with the consultant this fall. I don't know if it was September or October, and then having the final report due a year earlier.
Well, it does say by January 2022, the contract will be in place. So that's, I mean, it's not this fall, but it's not far away from this fall. 1 month away from the fall, actually, because December is the beginning of winter. So, committee, what are your thoughts on that? Let's just think about it, and then we're going to have to ask, probably is a joint fiscal ask question, why the date was modified. Yeah, go ahead, Ruth.
I agree that we should move it up a year to November 15th, 2022, and then January 15th, 2023. I mean, I mean, I'm hesitant to say this, but I just will. I don't think the study is that complex, like in terms of compared to other studies that we've asked for example. And I think having 2 years to do it seems excessive to me. I talked a little bit to Nolan, who I know is not able to be with us today, but he said the original study had a much broader scope, and that the scope was narrowed. So it may be that the original study needed more time and also more money, because one of my concerns is that I think the fiscal estimate for this study was $500,000, which also seems really excessive to me.
Right, it's going to be, it
I see
can't be
Ann's
that
face.
much. Yeah, no,
Yeah.
it's not. And I know that won't be the final number. So I think, given all of the concerns that we've heard and the information that we have at this time, without making a final decision to change, because we can come back to this on Tuesday, but I think we want to identify the markups that we want to make so that we can act on the bill early in the week next week. So my suggestion is, Katie, to be ready to change those dates. And so we would go. Go ahead, Ann. Yeah.
Okay, to me, figuring out the cost is pretty simple.
Yeah.
You take the number of people of childbearing age and you multiply it. Yeah. The challenge is, I'd like to see more than one scenario for funding this. As we first started going through this, I'm saying, why don't we just put it into the public school system? I mean, we already do early childhood, we do pre-K. Why not? I mean, look at that possibility of having it be part of our governor's talked about cradle to grave education. Look at that. Look at, I mean, I'd like a variety of possible funding.
So now you've just expanded what we're doing here. We want to make sure that we have the time to put everything in. I think that is the systems analysis will probably take that into consideration. I'm not sure we're ready to make a recommendation that this be.
No, I'm just saying that it should when you're looking at, we're talking about early childhood. We've
Well,
been
we're talking about, you know,
little
and
ones,
yeah, we're talking
but
about home
other
visiting.
countries do this.
Yes.
How do they do it? And look at, I just don't think that should be.
Well, look at I mean, the language here does say 0 to 5 and then 6 through 12. So the implication there would be around kids who are not in, kids who are preschool, and kids who are in school. So
In school is before and after school.
yeah.
So if I may, Madam Chair, I agree with Senator Cummings. I think we should ask them to give us more than one option, because there are varying options. It's not that hard. This is not that hard of a study, and they can give us varying options. And I think even looking at the 0 to 5, there's an option for a public option within the 0 to 5. It could be 3 to 6 is
Yep.
Because we have a UPK, a universal pre-K program that could be expanded. And so I do think that that's an option. I'm not saying that's definitely what we want to do, but I think having more than one recommendation, instead of saying this is the best recommendation, give us 3 recommendations that we could go for, or whatever. So I don't know.
Pros and cons.
Yeah, exactly. Katie, if you can put something in there about options and various recommendations, I think that would be really helpful to our conversation. And I can imagine finance, the discussion there about varying options for financing it.
So this report is directly about financing. It's about not spending more than 10%. It's about providers receiving compensation commensurate with peers in their field. It's about utilization of a cost share model versus a market rate model. So what other financing model or request would we put in here? Because when I'm hearing something somewhat different from what is actually here in this particular study. This is a financing study.
There are different ways to finance.
I'm understanding
those 3
that.
goals, there are different ways to finance it. So I think what Senator Cummings and I are interested in is options for how to finance it, not just one recommendation.
I'm trying to find out if there is an opportunity to put in here more than one option. I already see that there could be more than one option. So
let's just say it.
The financing piece is to ensure that families aren't spending more than 10%. That's one. Okay, that's
a
fine.
goal. That's not it. That's not a recommendation. That's just a goal for.
Oh, you're right. It is goals.
Yeah, those 3 are goals.
You're right.
So the recommendations have to reflect those goals.
Expanding the child's child care benefit, feasibility of implementing stable long-term funding sources. So you're wanting to add a C that would say some kind of comparative analysis for different financing systems that are comparative with other countries, other states, other opportunities.
Does this.
How do you want to say
I mean, I think
this?
that a good financing study will give you options. A good analyst will always give you options, but I want to make sure, and I think it's just a simple language that Katie could insert about, including multiple options for how to finance a system. So
let's put that under, let's make that a separate number. How about C? Cheryl, go ahead.
I was just going to say one of the options could be a public-private partnership. When we're listening to businesses who are very interested in this, then we should bring them in as well.
Yeah, most of these things are going to get funded with probably a combination, or there's going to be some kind of surcharge on a business tax or on a payroll tax, or on income tax. But I mean, there's going to be,
There's
if this
somebody's
is,
going to pay.
somebody's
I like
going to
the
pay,
idea.
and somebody's going to pay more if we want access for everyone. And while we're dealing with this, we still have the childcare cliff, which we haven't fixed. And, you know, if you're looking at lower income people who right now, given the number of women that are still on unemployment because they work at lower in wage jobs, they're good. That cliff is as much an impediment to moving forward in your life or your career or your earning capability
Right.
as the cost of, well, it is the cost of childcare because they fall
Right,
off.
because then you can't work because you can't pay
Can't
for it.
work because you
Yeah,
can't, yeah.
exactly. So,
So-
so I like Senator Hooker's suggestion of options, include options, and that for me it would be a big C after the A and B, and including public-private something,
Well-
public-private financing options, including.
Katie's trying to weigh in here. She has her yellow hand up.
Go for it.
Okay, thank you.
Blends in with the beds.
I
Oh,
couldn't
no.
see it. I could not see it.
So I'm looking at the language, and instead of adding a C, I'm wondering how the committee would feel about, gosh, I'm toggling between documents. Okay. How the committee would feel about amending B2. B2 is where the final report is being submitted. And I'm wondering if it could be something very simple that would say, on or before whatever date the consultant shall submit to committees X, Y, and Z, multiple financing options, including an option for a public-private partnership. And the results shall address the following, A and B. And I think I
Sounds
could
good.
word that a little bit more cleanly, but that would be the idea, that we would just kind of blend that idea of multiple options right into the final report section.
I would say instead of saying public, I think that's great, Katie, and that's what I was trying to suggest. So thank you. I would say instead of saying public-private partnership, because that's kind of this generic, something like options for public and private funding sources or
Sure.
something like that.
So
and
Katie,
I mean, 'cause it's a whole bunch of different funding sources. Anne's right. It's going to be like every dollar on deck.
we could float a childcare bond, do what Georgia has done for some of their environmental work. No, okay, we want to be like Georgia, so, okay.
Have to have a secure, guaranteed source of paying that bond. So
Exactly. It's got to come
you're
from
gonna have to come
something.
up with it eventually.
Okay, that's good. I think we've got the date, and we've maybe changed that language a little bit. That's good. Were there other sections? What section? Business people wanted to be involved. I think this is a consultant. This is not a place for the consultant can reach out to whomever and identify resources as consultants do. So we don't need to add language on who's involved with that, but I am interested in section.
Could we go through there were a couple.
Let me just
we go
find
through
my section.
Okay.
No. Yes, no, it's on section 10, and that is the American Rescue Plan and the Child Development Block Grant, and it has the Department of Children and Families in coordination with Building Bright Futures. And I would like to somehow have Joint Fiscal Office involved in this. whether it's as a consultant or included in this process.
Consultation with.
Yes, let's put in consultation with that. I think that might help. So the DCF is coordinating with Building Bright Futures, but I think in consultation with Joint Fiscal Office would be helpful. Because the use of the ARPA and the block grants and we don't know all the guidelines, but certainly the legislature or state government both will be, administration and legislature will be involved in that distribution of funds. So
Yeah,
anyway,
I think having GFO involved is a good idea. It's money.
yeah, hello.
Yeah.
I
So
mean,
if we're on
this language would leave it completely to an administrative process and a group of people. So I think it's important for us to have that link.
Were you thinking of putting language in about more involvement of business? I mean, we heard that business wanted to be more involved.
They do, and I'm wondering, was that section 10 or 14? I don't think it fits with section 14, but it does say shall convene a child care working group composed of mutually agreed to stakeholders. That which is more of the diversity issue. And so the business person is not directly in here. It's more of a, what are the needs? What are the child care needs? But I question.
So how is business involved in the original, Katie?
They're in there. If you look further down, it says, maybe Katie was just about to say this, but individuals representing families, childcare and after school providers, the business community, child welfare care advocates, and the consultation with any other individuals necessary. So they're already in there.
So I'm wondering what the question was or what the concern was of the business witnesses we heard from that said something had been taken out in the House.
I think I can help with that.
Okay.
The House version, an earlier version did not have this specific study. This was kind of in the very final draft, but there was an earlier group that was going to be run in part by Building Bright Futures, and that listed out a whole list of membership, and it specified each person from each entity. I think you're familiar with the type of list I'm talking about, where it says this person from the administration, this person from the administration, and then a representative of this organization. There were
Entire alphabet.
Yes.
Exactly. And
We
there
know
were
about
three separate business groups that were specifically called out in that list. And I think the committee ended up moving in a direction of not being as prescriptive and letting DCF and Building Bright Futures kind of organize the stakeholders that they thought would best help the task that was assigned to them, and gave some parameters, for example, child welfare advocates in the business community, instead of being as prescriptive.
Okay, so now I'm looking down at the charge for this, and their report is coming out November 2021. So I think that affirms the date changes that we made later, because this group is to inform the systems analysis and financing studies in sections 13 and 14. And I think I'm inclined to go along with the flexibility in who's contacted and how many. We could probably list a lot in this section. So I think Ruth and Ann, you both have your hands up. So go ahead, Ruth, go ahead.
Yeah, I agree that the whole list thing gets to be excessive. So I like this more generic thing. One thing I would suggest is to, instead of saying business community, maybe employer community or employer and business or something, because not all employers are businesses. And we want to make sure that nonprofit organization, arts organizations, colleges and universities, et cetera, government, et cetera, are at least represented in the language so that it's not just
Good.
businesses.
That's good. Yeah, smart. Okay, go ahead, Ian.
Okay, I'm gonna be fly at the picnic or in the ointment.
Uh-oh.
When we say business community, it is not homogeneous. The businesses for social responsibility do not represent the entire business community. And I don't see how we're going to get out of this without charging the entire business community somehow. So it would make it easier in the end if we're going to put social responsibility and Main Street Alliance, put the Chamber of Commerce on there too.
Well, we're not.
Nobody's on there. We're just
we're not
making
gonna
it
put-
generic.
There's nobody there.
Yeah, but I mean, not just one. You should have,
Diversity of businesses.
yes.
Employers and businesses.
Yes, employers and businesses. Good.
Yeah.
Okay, the word diversity, I think, becomes
Representing the
diversity of.
Katie,
diversity of the business.
can you mess around with that? Because I hear you, Anne. I think that makes sense. I just want to avoid the list, because then the list gets.
Yeah, no. I had to report the one that went to Z.
But we love that list. Come on, that was a great list.
Oh, God.
That's going to stay up on our bulletin board forever. Okay, so this is good. So Katie, do you get the gist of that one?
I do. The lead-in language makes it a little tricky.
Uh-oh.
So members of this working group shall include representatives of various legislative committees as well as individuals representing.
Wait, I think you're in the wrong place. So
No,
we're
no,
going
she's-
down to, and consultation, where is it?
I'm on section 10,
Yeah,
subsection A.
okay, go ahead. Sorry.
Okay, that's okay. Individuals representing, can we say the employer and business community? Or do you want to say
Yeah.
the diverse employer and business community? I'm just
Diversity
seeing that
of,
we have other broad categories listed, and I don't know that just adding the adjective gets you to where you want to be. And I almost feel like maybe saying the employer and business community might get you there.
I personally think that's fine, Katie, but
well, let's go to
I
Senator
just don't
Cummings.
want
Go to-
this.
What do you think, Ann?
Maybe the diversity. I don't want to end up with what we hear from are the people that are already on record as being advocates. I think, when you get to putting a tax on the small mom and pop stores, they will be in.
how about the broad employer and
How about a
Work.
range of employers
Yes,
and
that would,
members of the business community? Does that work?
that works.
Okay, phew, all right. Then that's better than the word diversity because that has other implications.
That has an implication that I
Yeah.
don't think is what we're looking for in this
No, it's
case.
already in there.
Right there.
I do, in this same section, under powers and duties, are we going to go there next in this list of the things?
Yeah, we
they're
can go
supposed to
there
do?
next.
Because
Well, let's make sure that we're all set with that. We're all set with that part up there. And then we'll go to powers and duties. Go ahead.
are we ready? Okay.
Yeah.
So starting on page 13, number 1, CDD expressed concerns about 1 and 2, about the potential for using one-time funds for these sort of ongoing things. And I agree that it could be problematic. Although these are just recommendations, they can recommend, like I said, in response to CDD, people recommend things to us all the time that we say no to. So we certainly can say no to it, but this sort of sets up the expectation that ARPA funds would be used for long-term expenses, or do you not think so?
They've got 3-year window.
Exactly. So we couldn't use ARPA funds for all of these things. I
But
don't
ARPA
think.
funds could be a bridge.
Mm-hmm.
Could
So
be a
maybe we
bridge.
just say a bridge and we just add that kind of thing, or sort of
Yeah.
like something, but it does have, I agree with them that this creates an expectation that isn't
Start
reasonable.
paying, yeah, if you start paying salaries or supplementing salaries, and 2 years out, the money, I was here. I wasn't in this building. I was advocating for pilot back in the 90s when we used essentially one-time funds to fund things like universal kindergarten. And then the money went away.
Mhm.
And the pain walking down the hall of this building was palpable. And I think the legislators who had to make the cuts at that point are pretty much gone.
So
But
the
it
language
was-
here, I think the
Yeah, we
language
don't,
of,
yeah,
the language of concern is at the top of page 13, where it says, to meet the immediate and future childcare needs of Vermonters. So somewhere in there, Katie, is bridge language.
Mm.
Wait,
And
where are you, Ginny?
it
I'm
is-
sorry, where?
I'm on the top of page 13, the last phrase of the second line, and future childcare needs. So that's something to think about, and we're going to have to move off of this and continue our discussion another time. But and I would ask you to go through the bill and bring your comments. But I think the future is the problem there, and we're really looking to use. And the other piece is, and I won't keep going. We have just added joint fiscal in here, and we're looking at ARPA funds, and joint fiscal is a good guardian of base funding. Which is another good reason to have the joint fiscal referenced above at the first part of section 10. So Katie, you've heard our conversations, so maybe as we move off of this bill and onto the next bill, do you need any clarification on that?
I do.
Okay.
On the section 14 dates, I heard that you wanted to change them. There are 3 dates. Are you only changing the date of the final report to January 1, 2023? Or were you changing other dates as well?
I think we wanted the preliminary report to come in early as well.
Okay, right now it's coming in November 15th, 2023.
Yes. So the consultant will be in place in 2020 and January 1, 22. Then the preliminary report would come in November 23 currently. So I think we're going to have to back things up.
I think we move that to November 15th, 2022. And then we move the other one to January 15th, 2023.
Okay, and is
That's-
Yeah.
It's just a 1 year to flip. Yeah.
and the consultant date that they have to contract by is fine, January 1, 2022? Okay.
I think so.
I think that works.
And then in section 10, I was thinking that because we're talking about this bridge funding, and the bridge funding really is only applicable to subdivisions B1 and 2, that is where that change could be added. Sorry, I switched to section 10. I think I didn't tell you that I just made that jump.
We went back
but-
with you.
Okay, good. Thank you. So I hear what you're saying, and I'm thinking that it should say bridge funding necessary to ensure in subdivision B1, and in subdivision B2, bridge funding to expand. I would feel hesitant to put that in introductory language, as it's not bridge funding for each of the items on the list, but only those 2. Does that make sense?
Yes, it does. Yeah.
Okay.
And obviously we'll be able to look at this when you get it fixed
And
up for us.
the last question is, would you like a strike all or would you like instances of amendment? You only have a few changes at this point, and I don't know if you anticipate making many more, or if you think it's easier to read a strike all.
It's so much easier to read a strike all.
Okay.
I think there's going to be more. Well, I at least want to talk about other changes too. We just haven't had a chance to get to them
Yeah,
in other parts of
exactly.
the bill. So if you can come back with like the yellow highlighted thing, that's really the easiest
Perfect.
way to track what changes we've made.
Sure, I can do that.
Okay, so I'm going to suggest that we move off of H-171. And I'm just want to look very briefly, we want to move to our next 132 to pick up testimony that we did not hear yesterday. And we are going to come back to this bill Tuesday morning and try to do some heavy lifting on the bill. So I'll send an email out to everyone over the weekend about the bill. So that'll help, I hope. Okay. Thank you. That's really good. I feel like we've made some progress on this. Let's move to S-132 and 120. And yesterday we did not hear from some folks, and they are all here. We have about 45 minutes, 40 to 45 minutes, and we have the Green Mountain Care Board is here with 3 people, and I'm going to turn to Susan, to you. I'm thinking that the best way to do this is to have a team presentation.
Great. And I will turn to Chair Mullen to kick this off. And so over to you.
Thanks, and good morning, everyone. It was a pretty fascinating conversation yesterday, and a lot of extremely important points were brought out. And I just want to echo a couple and try to highlight them. Patrick Flood talked about workforce and the real need for primary care. And what we know is that in other countries in the world that have better health outcomes in the US, they have twice as many primary care doctors as they do specialists. And we have the exact opposite in the United States. And I was hoping that somebody would quiz Patrick yesterday, because he seemed to indicate that he had some thoughts on how that could be addressed rather easily. And this is something that we've been working on for a few years, and nothing ever seems to be easy. I can give you some of the things that we have tried. We reached out to then Chancellor Spalding to try to get a PA program started in the state of Vermont. For Cheryl, she'll know the history where the College of St. Joseph in Rutland tried to start a PA program, and it wasn't the wrong thing to do. I think it would have made them sustainable in the long haul. But unfortunately, they tried it at the end of really when they didn't have the resources to properly foot it up. And I know that a PA program sounds like a daunting task, but when you're looking at the state college system in the situation that it's in, there would be some stiff upfront costs to start that program, but boy, would that really bolster the college system in the future years. So, I just want to point that out. And also, it's not just primary care doctors. Unfortunately, it's everything from mental health counselors to especially nurses. In my recent call with Northwest, monitoring their situation, Stephanie Brio, their CFO, indicated that they have 21 travelers right now, and the price that they're having to pay for those travelers has gone up exponentially. It used to be 200% of what it would cost to pay to hire a nurse in Vermont. It's now well over 300%. So she said for the 21 travelers that they have right now, they could hire 70 full-time Vermont nurses if those nurses were somehow available to them. So no system is going to be fixed if we don't address the workforce shortage. And that workforce shortage is driving up costs, as you can see with the levels being spent. So I just wanted to make sure that I threw that out there. And kept that at the front of all the work, because a successful healthcare reform effort will only be successful if there's sufficient primary care providers and other providers to make sure the system works. And right now, it's going back up exponentially again, the problems that we're having with the workforce. So a couple points too, before I turn it over to Susan, because Susan's really going to walk you through the comments, and she's going to be brief because we know your time is limited. But I just want to address one comment that was made yesterday. I don't lobby for things. What I do is I try to pursue the state strategy. You laid that out for the Green Mountain Care Board in Act 48 and in Act 113. And as a state regulator, we follow the statutes, and the statutes right now are that the plan for healthcare reform in the state of Vermont is a move away from volume to value. And so I don't want anybody to think that I lobbied anyone on anything other than we believe strongly that if the state strategy is to move to value, which we think is a very good strategy, then we as regulators are going to do everything that we can to try to make sure that we do move towards value. So just a clarification, I'm sure that it was really kind of a misstatement more than anything else that was made yesterday. But overall, I thought the conversation was great. And Susan will get into the details, but I just want to make sure that you do realize that the more clarity that you can put into the legislation, the much better off everyone is. And I just want to point out that, and Susan will get to this in her testimony, but the language around tying the compensation of the executive team to the median salary of primary care doctors would be problematic for us to currently certify the one ACO that we have in the state. And just want to make that very clear to everyone. And with that, I'm going to turn it over to Susan, who will walk through the sections. Thank you, Susan.
Thank you, Chair Mullen, and thank you, committee, for having us today. For the record, I'm Susan Barrett. I'm the Executive Director of the Green Mountain Care Board. And what I'll do today is I first want to touch on S120, and then I'll get into a general overview of S132, and then I can go into sections, but I'll follow your lead, Madam Chair, and we'll go from there. So,
so Susan, do you have this in? Can we get this in writing?
We do.
The testimony, because I'm looking at our time, and with
Perfect.
This is it for us on this bill, pretty much.
Yeah, that's why we put it in writing
Okay,
for
good.
that reason. So first, in terms of S120, we support the bill. We look forward to the insights and the information that you're going to learn, or potentially, if the bill passes. And we also want to offer any assistance to the committee that comes together, either in research or in data, in the regulatory and evaluation work that we do around the healthcare system. So that's S120, and I don't know if you have any further questions, but we do support that.
Yeah, could I just ask quickly? Susan, sorry. I'm happy to hear that, and I think actually having your assistance would be really helpful. The data presentations that we've been getting from your staff and members have been incredibly helpful. I love them, and I see Elena. Thank you so much. So, would it be okay to have you referenced in the bill so that it's clear that this committee would consult with you, or like sort of an in consultation kind of language?
That would be up to you, Senator Hardy, but we would welcome that, and whatever you need for research or anything that we can do to help you, we're always here.
Great, thank you. I appreciate that.
Great. And then I'll just give a general overview of S132. And then again, we have everything in writing, so we can send you a section by section after this. So we support the move to value-based care. We're committed to an all-payer approach to delivery system and payment reform. And we've experienced recently, as everyone knows, some significant data disruption in the model due to the pandemic, so that it's really unlikely that we'll be able to test the true value of this model as we had anticipated because of this disruption, really for 2020 and really going into 2021 as well. That said, we still see that we're going to have some clear lessons learned, and we're seeing that, and we're grateful for those lessons learned. We know that we need to keep moving away from fee-for-service, as I said, and that these volume-based payment models that we're looking at, and the models such as fee-for-service and towards value-based payment and delivery system reform allows Vermont providers to focus on keeping people healthy and out of the hospitals, and it addresses chronic illness rather than just treating the symptoms in a fee-for-service way. We must continue to increase fixed payments. The board has been committed to that from day one of this model. And we want to tackle the changes related to provider sustainability. And I'm just going to put a plug in for Elena here that we did produce an update for all of you and for the legislature on the sustainability report. And whether it's over the summer or later on, we'd be happy to come in and run. Actually, I'm offering Elena to run through that with you. She's the expert. So we saw the value of the value-based programs during the pandemic, and we saw those fixed payments really relieve some of the pressures that the providers felt as when we were shut down and patients couldn't come into the offices. But we also recognized that they weren't enough because our scale targets hadn't been met, because we need to increase scale, and we need to do that substantially. The current model, as we've said before, and I'll just say it again, it is provider-led and voluntary. We see the advantages in increasing equity in reimbursements that this bill addresses. Many areas of the bill do require the board to create a system that shifts from provider-led and voluntary participation to one that is state-led. So this is a big lift, as you can imagine. We would really want to study that carefully and make sure any changes are done, again, very carefully to ensure that we're attracting providers to these models and that these programs continue to work for the providers, but most importantly, for Vermont patients, because we need to keep talking about the patients and how this is affecting them. A couple of things on the ACO oversight statute. Chair Mullen brought up Act 113. This statute, it's already very difficult to document a lot of the results, I would say, or just document in general, because much of it is very qualitative in nature. Many of the requests in this bill reflect work that's already been being done in this statute. And additional statutory requirements associated with this bill would add to the administrative burden of documenting compliance with respect to the statute and add barriers, and that's on current participants, I would say. It could potentially add barriers to entry for other ACOs contemplating participation in the Vermont marketplace. So there's no requirement that there's only one ACO. There's nothing in the agreement that says that. And we would be very open to other ACOs coming into the market. I'll just close by, I mentioned the financial sustainability of our hospitals and the report that we just submitted as an update to you. We're considering a lot of the things in this bill, a lot of the things you talked about in S120 in that work as well. Just to tick off a few, we're looking at affordability. How are hospitals emerging from COVID? We know that there's really long backlogs of preventive testing that they need to get to so that we can make sure nothing is missed, like mammograms, like colonoscopies, and we need to support them in doing that. We want to look at how the hospitals are looking at health equity. We know that that is something that is going to be really important. It's really important now. It's finally getting discussed more, which is really music to all of our ears. But we also know at the federal level, even at CMMI and CMS, they're also looking at this. Everything they're going to do, they're going to look at it through a lens of health equity, which is so welcome. And, the last thing we're looking at, and really one of the more important things in terms of sustainability, is we're looking at how the hospitals are going to survive in a value-based world. So in our current system, as we look at it now, how do they transition to more of their payments being paid for value? And that, I don't want to take Elena's thunder, but that's what she would cover when we do get a chance to update you on that. I have the section by section, which I can just run through quickly, or I can just send it to you, Madam Chair. Which would you prefer?
Why don't you send it to us? Just,
Okay.
and if we can come back to it today, we will, but I think
Great.
it's probably best to do that. I do have a question for you.
Sure.
It's on S120, and there's the charge given to the committee that would include the efficacy of Vermont's all-payer accountable care organization model and changes that would be necessary to make healthcare more affordable for Vermonters, or whether an alternative model would be more effective. So I'm just looking for your comments on that, given that the affordability relates more to hospital caps, budget caps, and long-term outcomes and quality, health quality outcomes. So, and it's sort of more Medicare. Right now, it's a Medicare agreement, Medicaid, Medicare agreement with little participation on the private side. So I'm just wondering what your thoughts are on that.
Well,
chart.
I'll start, and I think Chair Mullen will chime in here, because I know we've talked about this a lot at the staff level. Let me just say that the board is committed to this model, to continuing this model. There is, as I stated earlier, we're learning quite a bit, and we know that it's not perfect, but we are making incremental changes. In terms of affordability, that is something that we look at, and again, I might just transition over to Chair Mullen here, but that's something we look at in our rate review process. It's obviously something we look at in our it's written into our rate review process. It's something we look at in our hospital budget review process. It's something that I think it would be very helpful if you, the legislature, could define that. We would be open to that process and work with you on it, on affordability, because it is
Okay.
the affordability in our rate review process is very, I would
It's a
say,
conflicting
undefined.
charge because
Can I, let me just ask this question.
Yeah.
Because I'm getting more information than I asked for. I'm asking if you think that this committee is the right committee to do this assessment. That's all I'm asking. And if the committee is reaching out to the Green Mountain Care Board for the data, there are implications here for the workload for you to do this. So I'm just asking that, given that we currently have a CMMI evaluation and that we recently got a letter back from the CMMI, and we also have the AHS involved here. So I'm wanting to know your opinion about, and your thoughts about, not an opinion, but a measured response to this particular number.
I would say that there is going to be, and it currently is, a federal evaluation of the all-payer ACO model. That's number one. That is being done currently by NORC and the University of Chicago, and they have a contract with our federal partners, And they were delayed a little bit because of the pandemic, but they are getting out now to start getting information and evaluating this model.
So then the question arises for me whether or not this is a valuable experience when perhaps some assessment of premiums and copays and rates might be more appropriate in determining affordability. So that's all. I go in a different direction. So, Chair Mullen, did you want to comment?
So just along your line of thinking, Madam Chair, when you talk about the premium rates and things like that, the statute in some respects is conflicting because it's designed that DFR offer a solvency opinion and set a range for the RBC, which is a measure of solvency. And so oftentimes we don't believe that a premium increase is affordable, but at the same token, we're kind of locked into the statute that sets that range for their RBC. So it's a conflict, and we wish we had some magic wand that we could meet both of those at the same time, but it's very difficult.
But so I guess, but I'm going back to the task or the charge given to the committee here on the efficacy of Vermont's all-payer accountable care organization model, given to the legislative committee. And I'm wondering, given that you may be included in this bill, and so that would be a request for your input on this. So I'm just wanting to know, is this something that's going to happen between now and November?
Do you mean the federal evaluation?
No, this is not, I'm looking at the bill. This is a
Right.
task for
For-
six
so-
legislators.
What I'm hearing you say, and maybe this is a good way to communicate, is to report back to you in what I'm hearing you ask. So are you asking, do we think it is appropriate for the S120 committee to be evaluating the efficacy of the all-payer model over the next 4 or 5 months?
That's exactly what I asked you.
It's a very large task. Let me just say
Well,
that.
Well,
And
but answer the question, is it something they can do? I
don't-
look at this and I think going out to visit with people in the state to talk about affordability, and this one is just layered on as almost Herculean and something the CMMI is currently doing. So
I think if you wanted to evaluate in the terms of like the federal evaluations, they evaluated the state innovation model, they'll evaluate the all-payer model. Typically, they are done they come out a couple of years after the model finished. So I think it also,
oh, sorry, Susan.
No, go ahead, Elena.
I'm going to add, I think it also depends how you're defining the evaluation. So the federal evaluation is a comparison. It's a statistical comparison of outcomes and inputs. If you're thinking about stakeholder process to learn how it's affecting Vermonters, I think that's a kind of a different task, and that could perhaps be done over a series of months. But I think if you're really looking at kind of understanding statistically if it's had an effect, number one, the data aren't there. So I think that's one challenge in of itself, but it also usually takes quite a bit longer to do.
So the word that's in the bill, and then we'll move on because we have 2 other witnesses, but the word that's in the bill is the efficacy of, and so that's significantly different from. So what do you think? It's significantly different, and so please think about that, and let us know your thoughts on that. I see 2 hands up. I'm hoping that they are quick questions, and because we need to move on to 2 more witnesses. Senator Hooker.
Thank you, Madam Chair, and thank you, Kevin and Susan and Elena. I guess my concern is that with this question of efficacy and the upcoming renewal of the contract, how can we enter into another contract without knowing the efficacy of the program that has been in effect? And so that's what I think we're trying to get at, or at least my intent in this bill is to find out if if the ACO is doing what it's supposed to be doing. Fine, go ahead, move on. If we find that it isn't, then we need to cut our losses. So that's where I'm coming from.
Can I
So
just
Senator
say-
Hooker, I would just say that the problem is because of the pandemic, it's hard to say for sure. And so I don't think that the state of Vermont should be rushing into a large multi-year extension, but I do think that there might be the need for a bridge period to actually give the current model a chance to work. And unfortunately, that might take, a 1 or 2 year extension or something to try to really get the facts on whether or not this is doable or it's a waste of time.
Yeah.
So.
And I appreciate that. And I'm wondering, is that a possibility? We don't have to enter into a 5-year contract.
Everything's a possibility. The way the current agreement works, we at the Green Mountain Care Board have to submit a report. I think it's December 21, maybe, Susan?
December end of this year.
Yeah. That
We may.
So I don't want to, I do need to interrupt the conversation. It's, yet again, it's an excellent conversation, but we have 2 folks who were here with us the other day and who need to testify. And so we'll move on. And if we get a minute or 2 at the end, we'll come right back to this. I know how important this is to everyone. So Kate Logan is here from Rights and Democracy. Kate, are you here? She's here.
I am.
Terrific. Thank you for
Hi.
being here. So
Thanks.
we've got about 15 or 20 minutes, and so we'll give you some of that time to provide us with your testimony.
Great. Thanks so much. My comments will be entirely focused on S120 this morning. And I sent a written copy of my testimony this morning to Nellie. I apologize if that got too late for your committee to have that right in front of you. But Rights and Democracy, I just want to thank you, first of all, for having us here to provide testimony on S120. We're a member of the coalition in support of S120. We're a grassroots, multi-issue, member-led organization. And our mission is to bring people together to take action to build healthy communities and make the values of our communities guide the policies of our government. We were founded in late 2015, and many of our founders in Vermont were leaders in the state's Healthcare as a Human Right campaign. Our members across both New Hampshire and Vermont consistently list healthcare as their top concern and are actively engaged in advocacy for high quality, affordable health insurance at the state and federal level. Rights and Democracy also participates in national coalitions that advocate for universal, equitably, and publicly financed healthcare programs. We believe that healthcare is a public good and that its unaffordability is rooted, at least in part, and possibly considerably in part, rooted in the decision to privatize and profit from what ought to be public programs. Further, over the last 2 years, Rights and Democracy has been working with partners in every state in New England to build local grassroots power across the region to win a jobs guarantee, universal health care, affordable housing, racial justice, and bold climate action. We are a founding member of the Renew New England Alliance, a regional coalition that now includes over 150 leading grassroots organizations across 6 states, including frontline communities, organized labor, Indigenous tribes, environmental justice advocates, youth groups, and racial justice organizations. As such, Rights and Democracy strongly supports S120 and urges the committee to pass the bill quickly. There are three aspects of S120 that I'd like to highlight in particular. First of all, it's coming at the right time. While Vermonters have needed us to take action for quite a long time to make healthcare more affordable, we know that the Biden administration now has a very large majority of Americans on their side in pursuing more public health care program options. It's time for states to signal that they're prepared to work with our federal government to move these programs forward. And work must begin immediately to build the legislative support for any sweeping changes to our healthcare system, including any significant expansion of our public healthcare programs, which is why the legislature needs to pass S120 this session. Further, the committee, as laid out in S120, is the appropriate vehicle to jumpstart a very necessary and broader public conversation at this time, as we're poised to see some significant reform in coming years. In particular, the Joint Legislative Healthcare Affordability Study Committee would directly engage with Vermonters who are most adversely impacted by lack of equitable access to healthcare through a series of community meetings. And this is the kind of participatory and democratic community-based research that we believe is essential to the development of public policy that meets our diverse communities' needs. If I were to offer any recommendations to this committee in terms of strengthening this bill, it would be to more generously resource this effort in order to ensure that every adversely impacted constituency is represented, which may sometimes require removal of any and all barriers to community participation, such as interpretation, transportation, child care, other material supports that would allow full participation of Vermonters in our communities, especially those many different kinds of constituencies that I've heard discussed in the committee so far, the diverse impacts of health care affordability and access in our communities for people with disabilities, Black, Indigenous, and other people of color, women, children, older Vermonters, et cetera. They all need to be in the conversation. And just to respond directly to the chair's questions for the Green Mountain Care Board members just prior regarding the efficacy of the ACO model. I understand your interest in that particular word. It does seem to me, based on what we've heard so far, that there is a process going on right now to help assess the efficacy of the ACO model, and that similar to every other thing that we've all been working on for years, the pandemic has interrupted things as normal. But it does seem, as part of this broader community conversation about healthcare affordability and access, that having our community members presented with some information about what we know on the ACO model and its efficacy, I think would be really helpful for folks. Many people in Vermont just simply don't understand why we're using the ACO model. And this would be an amazing opportunity for you to exercise your leadership in educating our communities about that and encouraging discussion. And finally, we support the committee's goal to consider practical and shorter term pathways to expand access to public healthcare programs. For example, bringing more youth and those over 50, for example, into public healthcare programs. I think specifically of my daughter. She was diagnosed with Crohn's disease when she was in 8th grade. At the time, I'm a single parent. At the time, I wasn't earning very much money, had recently moved to Vermont. And because of the child health insurance program in Vermont, she received over a course of a couple of years, somewhere in the neighborhood of $400,000 worth of medical care that I would not have been able to afford if it weren't for our child health insurance program. So expansion of those programs to gradually cover our whole community is something that Race and Democracy certainly supports, but also supports the mission of more broadly reviewing Vermont's current approach to managing healthcare affordability and educating our communities about that and gathering input. As a community organizer in particular, gathering community input right now on many of our big questions is something that we're already planning to do across a number of other areas. But we are, like I said, we prioritize healthcare, so we would enthusiastically like to participate in this community process. Our communities need both immediate options for reform and the opportunity to participate in community-led reflection on our need for more systematic and longer-term reforms. Thanks so much for your time.
Where did you go? Oh, there you are. My screen just went completely wild and you disappeared. Thank you so much. This is very helpful. And I've heard you say a couple of things that we will be able to talk about as we go forward on the bill. So thank you, Kate. And I'm going to move right on to Ruby because of our time, but your testimony has been very helpful. Ruby, thank you for being here. Did you get it started?
No, I didn't get it started. My next stop after this is the Toyota dealership. So thank you for taking my testimony from my husband's car this morning.
Okay.
Today was just not designed to be my day, but I appreciate your time today. I will do my best to keep my testimony brief, and I'm always happy to answer questions either in the committee or after the fact as needed. For the record, my name is Ruby Baker. I'm the Executive Director of Community of Vermont Elders. We are a nonprofit that has been operating, this is our 40th year of operation here in Vermont, and we support older adults through advocacy and education. Briefly, I want to speak to S120, and just to say that COVE members have been in discussion for years about how to make healthcare more affordable, especially as people retire and are living on fixed incomes and have increasingly complex healthcare needs. And we feel very strongly that it would be helpful for the state of Vermont to think beyond the current model, which does not seem to be accomplishing everything that we would like it to accomplish. And we would like to challenge ourselves to look at new and creative reform models. Specifically, we are very concerned and aware of how long-term care would be incorporated into any healthcare reform model. And we strongly support, in the process of all of this, the auditor having access to all records. And then moving on to S132, I will, the piece of it that I'm going to speak primarily to today is the hearing aid piece, which COVE and a number of advocates have come together to form a coalition called Hear Hear Vermont. And we've been working for about 6 months at this point to really raise awareness and move forward on this insurance mandate that is called for in S132. And I'll start quickly, I'm going to list off a couple of statistics. 13% of people over the age of 12 have some hearing loss. And age is the greatest determinant of disabling hearing loss, with 2% between ages 45 and 54. And then once you get to 75 and up, it is almost 50% of the population is experiencing disabling hearing loss. 64% of people with severe hearing loss report that they cannot afford hearing aids, which are medically necessary. And I think others yesterday certainly referred to or referenced the fact that many other medically necessary durable medical equipment and other devices are covered, and hearing aids should be among them. What we know about covering hearing aids is that it is preventative healthcare. We know it saves money in the long run. We know it prevents falls and death by falls. It delays Alzheimer's diagnosis. It can reduce the experience of depression and isolation, and it improves people's ability to be employed and part of the working world. And so then looking a little bit more specifically at what can be done, Vermont is actually the last state in New England to be considering this. All other states in New England have private healthcare coverage for hearing aids. We are behind the 8 ball on this one. And Connecticut, in fact, approved their coverage based on an internal analysis at the state level that determined it to be discriminatory not to cover hearing aids because it was excluding the healthcare needs of a disability population. And there are other states, specifically in the Pacific Northwest, who are also examining and exploring the disability aspect of this. But I would say that it is such an essential part of quality of life for people with hearing loss on so many levels. And there are many, many pathways that we could take to pursue hearing aids. This is probably the simplest, which is may feel daunting to folks when we're thinking about the essential health benefit. But it may also end up being the most affordable to the state if we go through the proper channels. And that's what this bill establishes, is the proper channels to examine and apply for apply to do that in such a way that the federal government would continue to support any increase in rates. And so I just have a couple of other things that I want to say, and I'm happy to answer any questions. One is that while I am very happy to be here speaking on behalf of older adults and on behalf of the coalition, I would strongly encourage you, as you continue to talk about hearing aids and the need for coverage, to hear from someone with hearing loss. I've been incredibly honored to work with many, many people who deal with disabling hearing loss within our coalition, and they can tell you more than I can about what this experience is like and what the impact would be on people with hearing loss in Vermont. In the course of 4 weeks, we sent out a petition and received over 1,300 signatures on our petition from all across the state of people who strongly support this bill and believe that it should be passed. We have 250 plus stories about people's personal experiences and challenges facing purchasing hearing aids, getting them repaired, accessing supports. And this really should be a human right to access medically necessary devices to allow for communication and participation in the world around us. One thing that I heard in discussion yesterday, and I just wanted to revisit, I guess, was a feeling that we've tried this before, we've been here, we've been working on this for a long time, and I would say that that's good, and we've only failed if we stop trying, and if we stop learning from our mistakes, and if we stop going through that iterative process to try and review and see what did or didn't work. If we stop doing that and we just say, well, this is good enough, then we have failed. But if we keep revisiting what we've built, I think that we can continue to improve what we have. So my last statement, I guess, is just that I believe S132 and S120 would fundamentally improve the lives of all Vermonters. And I encourage this committee to pass these bills and continue working on this.
Thank you. Ruby, that was very helpful and succinct. We appreciate it very much. And even from your husband's car. Good work. The time we're getting used to these unusual situations, but good luck with your car. It's not a good day to have it cut out on you.
No, I'm a bit damp from standing in the road, but thank you for the time.
Committee, we've done a lot of good work today, and I appreciate the overtime, the 2-minute overtime. we will come back to this. We have some work to do. And as I said earlier, I'll send an email out to committee members about process so we can complete all of our work. Susan, thank you for being here as well. And Elena and Chair Mullen, greatly appreciate it. So we're gonna call it a day. Nellie,